There is a new state-of-the-art testing to help reverse cognitive and early-stage Alzheimer's with a 92% success ratio. Dr. Stephen Wander joins us this morning to tell us more, and we welcome you. And we were just having a conversation about my family. I think everybody's family somehow has been affected by this disease. So you're telling me we can stop it?
We can. It's a 92% success ratio, as long as the case hasn't gone too far. Like, people have in their mind, you know, the worst case scenarios. But what you want to think about is prevention is the key, because there's state-of-the-art technology which can actually measure in the brain which part of the brain is degenerated, and is it degenerated, and basically, is it shrinking? And so the part of the brain will determine different parts of memory issues that someone has. And then therefore, even the best thing about this now is that test, state-of-the-art test, will show, do you have degeneration in the brain up to 40 years before any symptomatology takes place.
And that way, like you said, we can start preventing it from getting too far past.
Absolutely.
When do you know that there's a problem? I was just saying to you, like, sometimes I wake up and I'm like, I don't remember what I did last night or what I did yesterday for work or something like that. I'm 38 years old. Does that mean I'm already starting?
You know, it's obviously possible, and that's the best thing about the state-of-the-art technology, is that it will show you, is it happening objectively? Now, you know, the first thing a lot of people have is they can't find their keys.
Right.
Another very common thing that starts to happen, they can't balance their checkbook, something they've been doing for months and months. Problem solving, even simple arithmetic with a calculator. And so when these things start to sort of become a little bit more prevalent, and typically the first stage is the person knows before anyone else notices. And so if that's something that's kind of keeping occurring, and if you have a familiar history, that's something that you might want to get tested out. I mean, I just spoke at Harvard a couple months ago. George Ross, Donald Trump's longtime attorney and started The Apprentice, 92 years old, sharp as a tack. So there's no quote-unquote normal aging or normal decline in any cognitive ability.
So do people in their 30s start to have this problem?
People in their 30s can start to have the problem actually with the shrinking in the brain, but they might not be noticing any obvious symptomatology. But if they've seen their mom or their aunt or their grandmother or grandfather, that's how I got into this. My grandfather was diagnosed, and they basically said, Mr. Wander, there's nothing we can do for you. There's no treatment that currently works. There's no medication. We need to get your affairs in order, get a power of attorney, and we need to talk to your caretaker, because all the instruction at this point is for the caretaker and not the patient.
Right.
And that, to me, didn't make any sense. And so there's a method that was brought out in 2014. It's called the RECODE protocol, R-E, reverse, C-O, cognitive, D-E, decline. And it's over 92% successful. Over 2,900 cases have actually been reversed. So it's fantastic.
So explain the process to me and how that works.
First thing you have to do is, we need to know, is there shrinking? And then which parts of the brain, because there's not every case of dementia or cognitive decline or Alzheimer's is going to be exactly the same. So the case needs to be built from the ground up, specifically for the patient, based first on objective data with this technology. Then there's actually brain testing, which can tell, okay, are you having problems with memory? Are you having problems short term, long term? And so based on those results, there's different types of obviously treatment, and it's going to be different. Some is supplementation, some is nutraceutical, some is very specific brain training to help bring the memory back. One thing, the brain is 84% fat. So one thing everyone needs is a really, really good quality fat. So there's SCT oil, MCT oil, and it's extremely, every case has that. Must get this good fat into their system.
So, you know, I was saying, like, my grandma, I can talk to her, and I talked to her about growing up on the farm, and she can tell me all about that. But anything current and relevant, you know, she just keeps repeating what's going on there. So what's that mean?
That's typical, because, you know, if you ask someone what is their 6th grade teacher, they can get it. But what did they have for lunch yesterday? They have no idea. And so part of that is which part of the actual brain is being shrunk or degenerated. And part of that is very common for the majority of any patient who has cognitive decline.
How can people find you and start the process and get the testing?
The first thing is, they can contact us. We actually have a complimentary dinner workshop, so if people are interested, it's next Tuesday, October 16th at the Hilton Hotel in Rockville, Maryland. They can call 240-408-4157, or our website is dcfunctionalhealth.com, and it's, seating is limited. They'll qualify you to see if we can reserve a seat, and we go into a lot more details of what we're actually looking for and then what the treatment is.
That's great. You see the website on the bottom of your screen. You saw the phone number a moment ago. Make that call, and yeah, if we can prevent this, we can change a lot of lives, I'm sure. Thank you so much, Doctor, for coming in. We're going to have more of Let's Talk Live coming up right after the break, so stay with us.